I was not willing to accept that a full hysterectomy was my only solution.
Today on All Things Heart, a young woman from Joplin, Missouri refuses to accept what she was told was her only option. Her push for answers finally led her here to the University of Kansas Health System, where a doctor was able to diagnose her and fix the problem. And guess what? That hysterectomy was not the solution, not by a long shot.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning. It is Thursday, November 3rd. I'm Jessica Lovell in for Alexis Del Cid. Welcome to All Things Heart. Today, we are talking about pelvic congestion syndrome, the connection between it and your heart. And we'll hear from that woman who was misdiagnosed until she came here.
What it did for me is it put me at peace of mind that, you know, what I was feeling was not normal. And what was such a great relief was that Dr. Ali and his team were willing to listen to me.
Plus, we go behind the mask and get to know Dr. Adam Ali, the doctor who gave her her life back. And as always, we love answering your questions, so make sure you send those in to us on YouTube, Facebook, and the All Things Heart email. You can find links to all of those right there on your screen. How hard would you fight if your doctors didn't believe you? The woman you're about to meet became her own health advocate, traveling to the University of Kansas Health System, where she finally found a doctor who would listen.
Right by that freckle.
This small reddish mark on the right side of her neck is the only visible reminder of what Sherry Noller endured.
Today, I'm feeling great. I'm feeling wonderful without pain.
The Joplin woman's journey began in June of 2021.
I felt as though I had a constant icy hot feeling inside my body. It was a pain that would radiate down through my left leg down to about my knee, and at the worst of it would also be radiating up my left side into my rib cage.
Even more maddening, it was a pain deep inside her. Sherry couldn't find it, couldn't relieve it with any kind of pressure.
I was also feeling like my hips were just kind of out of joint a little bit. I was trying to stretch. I was trying to move around to get some relief, and nothing would help.
Over several months, she saw multiple doctors and had multiple scans and tests, everything coming up clean, indicating she was perfectly healthy.
It impacted my mental health for sure.
At 38, Sherry felt despair. Then she started doing her own internet searches, and she came across something intriguing. Dozens of Facebook pages and groups dedicated to something she'd never heard of, pelvic congestion syndrome. In the simplest terms, varicose veins in the pelvis.
What I found was a community of tens of thousands of women.
She asked her gynecologist in Joplin about it and says she was stunned when the doctor told Sherry that she didn't believe in pelvic congestion syndrome. Even worse,
the only way to remedy pelvic congestion syndrome was to have a full hysterectomy.
Sherry took the reins, reaching out to a doctor at the University of Kansas Health System that she'd read about through her various searches, vascular and interventional radiologist Dr. Adam Ali. Dr. Ali took one look at her CAT scan and validated everything. Sherry did have pelvic congestion syndrome, and even better, Dr. Ali could treat it quickly and completely. They would have to go through her jugular vein to do it.
I'm thinking they're going in through my jugular vein.
Right.
Jugular vein. You know, that's a very major vein.
It most certainly is, and Sherry Noller is here with us today, along with her interventional radiologist and surgeon, Dr. Adam Ali. How are you?
Good, how are you?
Good, good to see you. Sherry, welcome. I have to ask you straight out of the gate, how did it feel to be told that your condition didn't exist?
It was really hard to understand because I was not feeling right. My body was telling me there was something wrong, and to be told that it didn't exist or that the doctor didn't believe in it, it honestly made me want to fight harder for myself.
I bet. That's really frustrating. Here you are trying to get the right answers, doing your research, and to just simply not be believed. Dr. Alley, in detail, what exactly is pelvic congestion syndrome? Something I'd never heard of. I'm sure some of our listeners and viewers have not either. Tell us a little bit more about it.
You bet. So pelvic congestion syndrome, another name for it is ovarian vein insufficiency. And so essentially your veins take blood from your body back to your heart. Because the veins don't have the heart pumping behind it, there's no pressure. And so veins have valves that only open one way. When the valves don't work and they stay open, the blood will start to accumulate in that vein and it'll start pushing on the walls. So the way I like to describe it is you can think of it like blowing up a water balloon. As the vein fills up and the balloon fills up, the walls will get stretched. When the walls get stretched, they can get inflamed, they can hurt, they can cause some pretty big discomfort, and eventually they'll start taking a snake-like appearance on the CAT scan, and you can actually see that.
So is it rare? Why would a doctor think it didn't exist?
The reason for that is because there's multiple reasons that you can have pain in your pelvis. And so what we like to call it is a diagnosis of exclusion. So the first thing is you need to make sure that it's not something more serious. You do CAT scans, you go through that. And the idea is that sometimes when we take, if you take a lot of women who have had children and you do CAT scans on all of them, you can see dilated veins in a number of them that may not have any pain. The reality is right now that a lot of them do have pain, and for those, as in our case today, there are several options that we can offer to help with it.
So mainly women who've had children get this?
It's very common, yeah. So that's the most common patient that I'll see, yeah.
So we have some really interesting images, video illustrating pelvic congestion syndrome. So Doctor, we'll pull these up and kind of show us and walk us through some of these so someone understands what's happening inside the body during this syndrome.
Yeah, exactly. So this is just a good diagram. The left ovarian vein, which is what Sherry had, with the one that was dilated, drains into your left kidney vein. And so when you get pregnant, your uterus gets big, it can bang on those veins, it can damage the valves. And when those valves get damaged, as we just talked about, the blood can accumulate. So the idea is that when we're looking at it, we can actually access that vein, which we'll see here in a minute, through the left kidney vein, get down there and hopefully offer the treatment that we can offer.
So let's make the heart connection. How does this connect back to our heart?
So the cardiovascular system, the veins are all part of that system. So when we think about your heart, the blood that's going back to your heart all comes from your veins, and this is part of that.
So was she having a heart issue then that you were able to detect because of this other issue?
No, it's not a direct cardiac issue. It's more of the larger cardiovascular system. That way, yeah.
So let's bring up Sherry's images, and you can maybe walk us through these and tell us what we're looking at.
Yeah.
What is that?
So this is actually not Sherry. This is an example.
Okay.
This is just a video, another example of we're putting coils into the ovarian vein. And so the idea for treatment is that we want to fill the vein with coils, which, as you can see, literally look like a slinky. They stay in your body forever. You can't feel them. You don't know that they're there. But the idea is that you can think of it like cement in a garden hose, so it can't fill up with blood anymore. In addition to those coils, I also used a foam detergent to help kind of scar the sides down and the nest in the bottom to make sure we get into all the smaller veins as well.
So Sherry, excuse me, please.
Yeah, so the image following this is the ones that you can see that are actually Sherry's images. So there you can see the ovarian vein. It's dilated, which means it's bigger than 7 millimeters. That's after we're done, so it's not filling anymore. And this next one's a key image. So this is in the left kidney vein, and the black stuff is the dye where the blood goes. And as it's traveling down that ovarian vein, that's what the reflux is. So typically, when the valves are working, you won't see that. So that's the first thing that we can look for to know that she's got reflux.
Is this a permanent treatment?
It is a permanent treatment. So.
And what kind of follow-up might Sherry have to do?
So she came back in 6 weeks to check her to make sure everything was going great. She had complete resolution of her symptoms, and so we moved on from there. The reason that, and then she can just come back and see me when she needs to at that point. There are other options. Occasionally, you know, there are additional things that we can offer for some patients who don't get complete relief, which is why we like to follow up. but I'd say a large majority of the time we get this done and it takes care of it.
Fantastic. And Sherry, this must have been a relief for you to finally find Dr. Alley, and it spared you that hysterectomy. Tell us how you found him and what those kind of initial conversations were like when you were finally believed.
Yeah, so again, I'd started finding those communities on Facebook, and it, I guess, opened up my eyes to maybe some different keywords to search. And so I just started Googling pelvic congestion syndrome, left lower pelvic pain, and in the different searches, the University of Kansas healthcare system came up. And I looked at my husband and I said, this is just a couple hours north of us, and they might actually have a solution. So, I went on the site, and one of the amazing things that I saw on the site is that a hysterectomy was not even one of the treatment options for pelvic congestion syndrome. And with that, it gave me a sense of relief. When I had this procedure done, I was 38 years old. I have 2 very active boys, and although I don't plan on having any more kids at this point in time, I also wasn't really interested in having a hysterectomy and starting the menopause phase of my life just yet. So it was really exciting, and Dr. Alley's team was phenomenal to work with. They communicated so well with me, put me at ease when we were having some challenges, making sure that they were getting the correct scans to view, and then had an opportunity to meet Dr. Alley for an office visit, and he was so nice. And again, for me, it was really a sigh of relief that there was a doctor who was listening to me and was understanding where I was coming from, and then also said, it looks pretty clear to me that you have this, and there's a treatment option. And I was so excited. I went home after that in-person visit with Dr. Alley, and I just started feeling better. I was still had the pain and discomfort, but I had a sense of hope that just after Christmas last year I was going to be able to find some relief.
That's such a great story, and I think it really truly speaks to the power of the second opinion that we talk about. Sometimes we are the second opinion, sometimes we send people for second opinions, and in this case you were that, and were able to give her some good news, right?
Yeah, we were very excited to help. So at KU we're really excited to have our multidisciplinary vascular team. So it's vascular interventional radiology, vascular surgery, vascular medicine, cardiology. We're all within the same space. So a lot of times we'll get referrals for different things, and we're all sitting right next to each other. We have clinic in the same space, so we can immediately refer them. And as you're talking about, that second opinion to get them to the appropriate specialist. So,
Sherry, I love what you mentioned about listening, because when I do stories with patients, the number one thing they say when they talk about how much and why they love their doctor, it's because they look them in the eye and they just are there and they're present and they listen. So that can go a long way, even before you get to the treatment part of it. Dr. Alley, we mentioned in the story, the top of the story, that you went through her jugular vein, and as Sherry mentioned, that's a big vein. That's kind of an important one. But why go through there? And once you're in there, what are you doing? And that's kind of a long journey to go from the neck down to where it needs to go.
Yeah, so what we do in vascular interventional radiology are minimally invasive procedures. So as she noted, she just has that little nick in her neck. The way the anatomy is and the way that kidney vein comes off, if you come in from the top, the angle from a technical standpoint facilitates getting our instruments and our tubes down to where they need to be in the safest and most efficient way. There's an additional way to come from the hip where you go up and over. In my experience, I prefer to come from the neck. It just makes it a little bit easier. And so that's why we do that.
She trusted you. Sounded like a big vein, but he did it right, and you said that was the safest way to go. I want to put up on the screen a QR code that will take you to our resources for pelvic congestion syndrome. So just hover over that with your cell, click on that link, more information to the resources, but also just to hear and learn more about what we're talking about today. I want to get to some community questions. We've got some good ones. And Jessica wants to know, what was the recovery like for you, Sherry?
So coming out of the procedure, I did have to wait about, I believe it was about 2 to 3 hours there at the hospital. And then after that, I just needed to take it easy. One of the pictures that was shown in the package was of some gauze and bandage essentially on my neck. I had to keep that on for 24 hours and, just kind of take it easy, not do anything too strenuous. And after that, I was ready to go. And actually, when I came out of the procedure, the pain was gone. So I already knew that it worked. And I thought, well, 24 hours, a few days after Christmas to take it easy. I'm like, I probably owe myself that anyways. But I was back to doing normal work. I mean, there was no limitations. Once my husband got me home, the next day I was out doing errands with my family and, getting ready to enjoy New Year's Eve.
Yeah, back to life. That's what we like to hear. Dr. Alley, you mentioned earlier that primarily women who've had children get this, but Mark wants to know, can men get pelvic congestion syndrome?
Yeah, so you can get testicular vein reflux. In men, it is testicular pain. So it doesn't tend to be pelvic pain the way you see it in women. And what you can have is a varicocele in your testicle, which is commonly described as a bag of worms. So if you have pain and you feel like there's something like a bag of worms, please see a medical professional so they can evaluate you and get the appropriate imaging and do the appropriate exam. The treatment is very similar if it does end up being that. We do put coils in the testicular vein and it can help.
Okay, Gretchen wants to know, again, back to the jugular. It's coming back to the jugular because that's our vein we always are trying to protect. Is there any danger going there? You said it's the safest way. I believe you there, but any danger, or maybe somebody who wouldn't be a candidate to get in there that way?
Yeah, so it is a common access point for us to get into the venous system within your body. So inherently with anything you do whenever you're doing a procedure, there are some underlying risks. Overall, I would say that I probably get into the internal jugular vein on a daily basis on our patients, and they do remarkably well. As I stated before, there's other ways you can get into. There's the femoral vein over the hip, and there's several veins over your body that we can try to get into the venous system if we have to. Which in certain cases we do when, for instance, the jugular vein is blocked for this reason or that reason.
So Laura says she has some varicose veins on her legs. Does that mean that she could have pelvic congestion syndrome?
Yes, so varicose veins on your legs can be related to pelvic congestion syndrome. It doesn't mean that it is though. So varicose veins in your legs could be just that, varicose veins that are only affecting your legs. If they are bothering you, if you do have pain, especially if you have skin breakdown or an ulcer, or if you have swelling around your ankle from those veins, please see a medical professional or a vascular specialist who can help you evaluate your venous disease in your legs and get you the appropriate care.
And can you just go to your regular general doctor to ask questions about that, and then they would send you to a specialist? What would be that, or can you self-refer?
Yeah, correct. So you can go to your regular doctor. They will likely send you to a vascular specialist. If you know you have varicose veins and you see them, you can just call the vascular center and make an appointment for your varicose veins, and we'll be happy to see you.
So Regina has a question for Sherry, and just thinking about how frustrating it must have been to hear that you were going to have a drastic hysterectomy at 38, something you were not ready for in your life, but that you got that second opinion, you took control of your health. Just what advice do you have for people to make sure that they're asking those questions, and it's okay to question doctors and look further than what you're being told?
Well, I guess first and foremost, a commitment that I had made to myself actually in 2019 was to prioritize my health. Being a wife, having kids, I did a great job of making sure that the rest of my family saw their doctors, but I didn't do a great job of taking care of myself in that way. So when I started to experience this in 2021, I reminded myself that I had made the commitment to myself to not just let this continue to bother me, and that I needed to find answers so that I could get some peace of mind and get some relief. And what I would encourage others to do is trust your body. you know if something doesn't feel right, or if what you're experiencing isn't normal for you. And that was something that was really important for me to understand, because growing up, since a young woman, I had very painful menstrual cycles. It's a common thing for me. There were just things and pain that I was familiar with in my body that this was like nothing I had ever experienced before. And like in the package, I was trying everything. I actually had a second opinion from a gastroenterologist, and they prescribed me nerve medication for 2 weeks, thinking that they said, well, it's not a gastro issue, but I don't know what it could be, so here, take this. And I wasn't comfortable. I mean, I did it for about a week and had no relief, and I didn't feel comfortable staying on a nerve medication without any answers. And so I stopped taking the medication, and during the time I was continuing my research and continuing the communications to get an appointment with Dr. Alley, because I knew that what I was experiencing was not normal for my body. And that's what I continued to tell myself, is what you're experiencing isn't what you're used to. Go see if you can find answers from somebody else. And that's what I did. And I recommend that for everyone.
And I'm so glad you had that epiphany to put mom first, because if you're not doing well, you can't hound on the hubby and the kids to take care of themselves and to go get checked out. So you gotta put yourself first, and that's okay. Doc, how did you become an expert in pelvic congestion syndrome? Sarah wants to know.
So a lot of training. So what I do is, as part of my overall specialty, is I treat a lot of arteries and veins. And so through my training and the techniques that we use to treat this is very specialized. It's specifically designed to treat vessels like that, such as how to put those coils in, how to put that foam in, how to recognize the imaging that you see. And so the specialty that I chose and the training that I've gone through really focuses in on it. And using that as part of the ovarian vein insufficiency is how I was able to treat all this kind of stuff.
Okay, before we wrap up today, could you just go over the most common symptoms for pelvic congestion syndrome?
Yeah, so you can have heaviness and throbbing and aching within your pelvis. It can cause pain with intercourse. You can have pelvic varicosities, so veins in your pelvis. Additionally, you can have bleeding from them, and those tend to be the most typical.
Can it ever be confused with something else? Or when she came to you, was it like you knew exactly what that was?
Yeah, so it's really important to make sure, if you do have those symptoms, to get complete care. So I would recommend for everyone who has those to see their gynecologist, make sure they get a full workup. There are other things that can cause pelvic pain. And once we've established that that's what we think it is, then the treatment can proceed. But it's really, really important. I need to emphasize that you make sure you keep up with your general health care and rule out anything else that can cause that.
Thank you for that. I want to get to our final thoughts today. Sherry, I want to start with you. You've given us some great advice and great insight. Anything else you want to share with us today before we go?
I guess one thing for me is that knowing about pelvic congestion syndrome and talking about it to others is something that has become really important to me because of my experience. I had an annual checkup with my general practice doctor a month ago and told him that I was treated and the treatment that I received. And he said, "Where did you go and how did you find them? Because I have women who come in here every year who are experiencing this type of pain, and I haven't known where to send them." And so that's helped me feel really good about the fact that I feel as though my experience is helping others to understand what's going on with them so that they can feel hopefully a sense of relief as well. And I do just want to extend a lot of gratitude to Dr. Alley and the work that he's doing, and just the work that's being done there at the University of Kansas healthcare system, because it made a huge difference for me. It made a huge difference for my family to have their mom and wife back. And without that, without having someone believe in me, I don't know where I would be right now. Who knows what I would have felt my options were, but I'm just very, very thankful that we have these resources. And not being too far away from Kansas City. I'm very thankful that the University of Kansas health system has the resources that they do that we can rely on and utilize here in the Midwest.
Sherry, thank you so much for sharing your story today. A grateful patient. Can't feel better than that, can it, Dr. Alley?
I'm so happy that we could help. That's why most of us go into this field in the first place, so it's wonderful to hear that.
See these end results. Just your final thoughts or message to other women, maybe some men, but folks that are watching.
Yeah, so if you do have pain that you can't explain, and it's bothering you and your quality of life is not where you think it should be, please go see somebody. A lot of people sit on it and try to be tough. But we are here to help. There's a lot of people here who work hard every day. We're working together to help make your life better. So please don't hesitate to come and see us, and we will do our best to see what we can do.
Thank you. I'm not done with you just yet, though, because
okay.
now we're going to one of our favorite parts of the show, where you get to know our doctors kind of the way we know them, although we find out new things about them all the time. So what are they really like outside of the hospital, right? So we're going to go behind the mask with Dr. Alley. Excited to talk to you about this, because in June, you took your mother to Istanbul, Turkey. You got to meet some family that you'd never met there before. Tell us about this trip.
Yeah, so I am a quarter Turkish. My grandmother was Turkish, and so growing up, my mom would go to Istanbul all the time to visit her family. She's kept in touch with them over the years. I've never met them before. I'd never been there. So in June, we booked some tickets and we went over, and it was amazing. It was probably the highlight of my year so far to get to meet them. I was super excited to meet them. I had not anticipated how excited they would be to meet me. So it was a lot of fun.
I bet. What an experience. Yeah. And just to travel and be out and see the world. Do you travel a lot? Or was this the first big trip with Mom?
Not the first big trip with Mom. I do like to travel. Obviously, in the last few years, it's been a little bit more challenging. Mm-hmm. So this year is when I started to pick it up again.
Okay,
so.
Where's maybe been one of your, besides Turkey, where's maybe been one of your favorite places to go?
Oh, Barcelona for sure.
Oh, really?
Yeah.
Good food, good people.
Amazing food, amazing ocean. Amazing people. Yeah, it was a lot of fun.
Okay, speaking of the water. Okay, I want to show one more thing. We're never going to get you sick of this video, by the way. We're going to reuse this over and over. I don't know if you do this with your mom or not, but
my mom didn't know.
No, you're going to keep Mom off of the flyboard. Is that right? All right,
yeah.
Let's go and watch this.
Yeah, so this was in Miami, actually. And so that,
Miami, okay.
Yeah, that was, we took a boat ride on the water, and one of the options you could do was that, and so it was a lot of fun.
Are you using a lot of ab muscles here? Because that
I'm using every muscle in my body there. Yeah.
You were a little in pain, maybe later laying down.
I was.
Never done that before? Was this the first time for you?
That was the first time, yeah.
Okay.
But yeah, it was a lot of fun.
You know, every time you come on, we're just going to have to find some random excuse to show that fun video. So very, very cool. All right. Thank you so much for being with us today. We want to take a minute to share something pretty cool. Some cool news for our heart department. We broke a record here at the University of Kansas Health System this past September with 6 heart transplants in just 1 month. Coordinators say the typical number of transplant patients per month is about 1 to 3.
We all really care, and I think that comes through from the physicians to social workers to case management to infectious disease, all the different specialties that we require to take care of our patients. It's just a really invested team that works well together.
We pull a ton of people together: social work, pharmacy, surgical teams. It takes an entire conglomerate to make this be successful.
We have such a great team here. So thank you to them. Thank you to Dr. Alley. Thank you to Sherry for sharing her story with us today. And coming up, we have a preview of next week's All Things Heart. Have a great day.
To be honest, I've heard of all type of cancers, but I never heard of multiple myeloma.
And then he was told the very treatments meant to cure him could cause his heart to fail. How doctors here guided him through his epic battle for life against multiple myeloma. That's next Thursday morning at 10.